Welcome, everybody. It's Georgia Reed, managing editor and podcast host for Cybercrime Magazine, and I'm here today with Mac McMillan of CynergisTek. He's the co-founder and CEO there, and they're an information and security service firm specializing in consulting and managed privacy for the healthcare industry. So we welcome Mac. Thanks for being here today. Just want to hear a little bit about yourself, because cybersecurity, I mean, it's as much about technology as it is about people. So let's start off. Let me hear a little bit about you and how you got started in this field and the early part of your career.
Sure. So interestingly enough, I don't come from a technology background. I came out of, I was in the military, in the Marine Corps. I was an intelligence officer. I then transitioned over to the civilian side but I transitioned at that point into security, managing security at a couple of defense agencies. And so I actually became responsible for cybersecurity at that point, right? So because if you look at the way we do it in the Department of Defense, all of the 27 different types of security are all under one person. They're all under the director of security. So in that case, that was me. So that's how I got introduced to it. I didn't come at it through computers. I didn't come at it through technology. I came at it through managing operational risk for an organization.
And you spent 11 years at the Department of Defense, is that correct?
Well, I actually spent 22, but I spent 11 of it it was a combination. I started with the On-Site Inspection Agency, which then became part of the Defense Threat Reduction Agency. So
what exactly did you do when you were at that agency, and did that help prepare for a career in the private sector later on? I mean, is that a benefit?
It was, because I was the director of security for the agency. So I managed all the security programs that we had across the globe, which included information security and or computer security.
And what about the healthcare security industry specifically?
So that was kind of a happy accident, if you will. Meaning, when I got ready to retire, I had a friend who asked me to come speak to a hospital up in Baltimore, Maryland, about cybersecurity, and it was my first foray into the private sector. And I went up there and I got a tour of the hospital, met with the CIO, then met with the board. And I was just absolutely taken aback. Remember, this is 2001.
Okay.
I was absolutely taken aback by the lack of security, coming from the environment that I came out of, where we were ultra secure. And I thought, wow, this is an industry, if they're about to be regulated, that's going to have a tremendous amount of need for quite a while. Because I had experienced going through that revolution, if you will, or evolution in the federal space, because we started really approaching computer security in a big way in the 80s, but it wasn't until the mid-90s that we actually had a consistent program across the government with respect to computer security. So it takes a while, right? So I assumed that in our environment, where people could be told and directed to do this, that when you
in the government, you mean?
Right.
Yeah.
Going out to the private sector and trying to do that, where people had to be convinced that this was a good thing to do, it was probably going to be a little bit longer ramp.
Okay, and then that led up to late 2003 when you co-founded CynergisTek.
Yeah, so what I did when I first left, I went to work for a company that did health IT work and created a cyber practice for them. That helped me learn the industry and learn about the private sector. And then at the end of 2003, I decided I was ready to go start CynergisTek.
So over the past 15 or so years, how has it grown? How has it developed? And where do we see CynergisTek going from here?
So it's grown consistently. Well, first of all, my partner and I grew CynergisTek for the first 14 years as a private company. And then at the end of 2016, we sold that company to a larger company, and our company actually became the larger company about 6 months later. So it remains CynergisTek. But the way we've changed over time is we've listened to our customers and paid attention to what's going on out there in the industry and the environment. And we've focused on providing services. There are a lot of companies that provide products and whatnot, or solutions, but we've always focused on helping them solve the operational issues that they have in terms of these programs that they have to implement in order to be effective. And that's typically the hardest part of the problem for them.
I definitely want to get back to that. Before we talk about hospitals specifically, I just wanted to mention that your company was included in our Cybersecurity 500 list for 2018.
Saw that?
Yep, and one of the most important criteria for making that list is how the CISOs we interviewed, they wanted to hear about longevity of a company. So how has longevity in healthcare helped your company grow?
I think it's helped tremendously because healthcare is a relationship-based industry, right? I mean, people go into healthcare and they're there their entire careers. And in some cases, they're at their institution for their entire career. So we run into folks who've been in a hospital or been in this industry for 30, 35 years, and I've been in it for 20 now. And what we've seen is that what we did early on was we focused on that. We focused on building relationships with the people in the industry, as opposed to just trying to grow the business per se. And what we found is that over time, as those relationships grew and got stronger, and they began to help us grow our company, and we actually grew even faster as a result of that. And we saw different periods of time where we've seen other companies come in and go out, come in and go out. Or come in and not come back and go out and never come back. And they like the fact that we have been there and known them for 20 years now.
Okay. So speaking of the relationships, I know you're a big believer in giving back, particularly when it comes to educating the industry and next generation of cybersecurity professionals. So what are some of the things that you're doing to give back, and what is CynergisTek doing with the industry that you find to be important?
So early on, one of the things that I recognized about this whole scenario was that it was going to be an education-based phenomenon, meaning the industry was going to have to learn what cybersecurity is and how to do it. And so one of the things that we have focused on since day one is providing education to our customers and to the industry. And we have been very active in supporting all the different organizations and the associations out there in healthcare and bringing education to those venues. But we do over 40 regional seminars ourselves a year that customers and individuals don't have to pay to come to. It's just there for education. And then in addition to that, we have a dedicated group of individuals, all of which have almost 30 years of experience or more. And their sole role is to provide presentations and education and advisory services, not only to our customers, but to the industry, which is a commitment that we made that has paid off in tenfold in terms of how people perceive us in the industry, I think.
Oh, that's really great. I want to go back to talk about the healthcare industry and hospitals, and that's CynergisTek's focus. So healthcare is one of the most attacked industries when it comes to cyber attacks, and so why is that?
You know, if you believe what you hear, and there's really three reasons. The first one is this convergence of what we've done with healthcare over the last decade, if you will, or 15 years, and that is that if you go back before 2009, 1 in 10 organizations had an EHR, had their data digitized. Mm-hmm. Today, less than 1 in 10 don't have all of their data digitized. I mean, You look at the environment we're in today. It is an absolutely information-rich and information facilitated industry, right? I mean, everything they do in a hospital today is automated. There's a process, there's a computer system or a program that supports it, and all the information about their patients and everything they do is digitized.
Right, patient records, everything.
Everything. So the second part of that is that the information they have is a treasure trove for cyber criminals, because unlike a lot of other industries, they have a tremendous amount of information on the people that they support and that they serve, and so the information is valuable. And the last part of it, unfortunately, is that the criminals know that in most cases they're not prepared, that they haven't made the investment. I mean, you look at in cybersecurity. I mean, you look at the investment in healthcare as compared to other industries. we're still investing less than a third what other industries are investing in cybersecurity.
But they've invested a lot into digitizing and going technical
Oh, yeah.
in the hospitals. But do you think that was a distraction from cybersecurity? They were paying too much attention to digitizing the patient records, for example. How come it wasn't, investing at the same time with cybersecurity initiatives?
Well, I don't know that it was a distraction. I think it was their focus. Right, and in some instances they really didn't have a choice, right? I mean, they had to comply with the new laws that were out there, and let's face it, in today's environment, the consumer expects that the healthcare professional is going to have their record at their fingertips. In fact, they almost expect that they're going to have their record at their fingertips.
So aside from patient records, the IT infrastructure of the hospital itself is also at risk. So what about the patients themselves? Are there cyber threats that can directly attack and affect and possibly harm people who are being cared for in these hospitals? For instance, are there scenarios where a ransomware attack could affect patient care?
Certainly. I mean, we just had one at the early part of this week or last week or whenever, that we had a hospital that went down with an attack. In this case, I think it was just a virus attack, not necessarily ransomware. But it affected their systems to the point that they had to divert ambulances, they had to cancel procedures. We've had hospitals that have had to cancel operations, that have had those things happen. I mean, there's a lot of things that can impact a patient in those environments. Our healthcare organizations do a phenomenal job trying to make sure that never occurs. But the thing that I worry about the most are things that are attacks that they don't see or that they're not aware of. So, for instance, things like data integrity. It's one thing when a system goes offline, you know it. You know the data, the system's missing. The data is missing perhaps, and you fail over to whatever it is that you would do. But what happens when somebody gets into a database and corrupts the database, or changes the parameters on a system, the reporting that the doctor is looking at? So I worry more about those scenarios, which to my knowledge we haven't seen, but certainly we know that data can be manipulated in other environments. There's no reason why it can't be manipulated in healthcare.
And Cybersecurity Ventures predicts that ransomware attacks on hospitals will quadruple over the next few years. So what are some of the precautions hospitals can take, such as training employees on security to reduce that threat?
So in my mind, there's really three things that I think are most important. The first one is building a solid incident recognition environment, meaning building an environment that it gives you enough awareness that something's going on so that you can react to it quickly, isolate it, and hopefully mitigate the impact of it. The second part of it is absolutely have a good response and recovery process. Make sure your data is backed up. Make sure your systems are backed up, your configurations, et cetera. We had a hospital not too long ago that had a ransomware attack. They had all their data backed up, but they didn't have all the latest configurations for their systems or their applications. And so all of a sudden, we couldn't restore the data until we could figure out how to restore the network first.
Gotcha.
And right, so there's you have to think of all of those things, and then last but not least, absolutely, we have staff today that have never operated in an environment where they don't have an automated tool, and we need to pay attention to that. We need to recognize that our younger professionals in the medical field need to be able to do their job if all of a sudden that device that's in their hand isn't working, or the computer that's at the nurse's station isn't working, or the systems that are in the patient's room aren't working.
So you're saying young people, they're very tech savvy, but when the technology's not there, what are they going to do?
Yeah, because we've taught them all these shortcuts, and we've taught them how to use all this technology, but we've forgotten along the way that what do you do when you don't have that? So
if a hospital is hit by a ransomware attack, should they pay the ransom?
So I would say no, and part of that's just me being a cybersecurity guy. You never want to pay the ransom because it obviously promotes or entices them to do it again. But it's easy to say that when you're away from it, right? If you're the operator who has patients that need to be cared for, and the only way that you can support them is by paying the ransom, right? You know, in those instances, I think any prudent, responsible executive is going to say, I'm going to pay the ransom, take care of my patients, and I'll deal with the rest of it afterwards.
Interesting.
And they do, and that's
Right.
essentially what happens.
So that leads me to my next question, which is about implantable medical devices, defibrillators, pacemakers, deep brain neurostimulators, insulin pumps, ear tubes. Can people be hacked now via their wirelessly connected and digitally monitored IMDs?
So we know they can. We've had it demonstrated at things like DEF CON and Black Hat and whatnot. Will that happen? Could it happen? I think the more likely scenario is not so much that somebody does it directly. In other words, I want to hurt you. I think what I worry about is a scenario where somebody launches an IoT type attack and it's indiscriminate. Or it's somebody who launches it who doesn't know what they're doing and doesn't know how to control it, or doesn't know the unintended consequences of it or the collateral damage that it could cause. And then all of a sudden we have devices that are affected that were never intended to be affected, and we have individuals hurt as a side effect of that. I think it's much more likely that we'll see that kind of an indiscriminate attack that affects patients than somebody who, because I think the cyber criminals know that it's one thing to steal information, it's another thing to go after people. You're going to really get a lot of attention when you start hurting people.
Right, maybe they don't want that attention at all.
No, they don't.
Speaking of people, okay, so CynergisTek, how have you guys managed to recruit and retain your cybersecurity talent at CynergisTek?
So there's several ways. I mean, obviously we recruit at universities, we recruit from the military, we recruit from the rank and file of folks that are out there. It's a tougher environment today to find really quality folks, because you have, number one, you have zero unemployment right in cybersecurity right now. So you're basically taking a person from somebody to fill a role for you. One of my concerns is that we have a lot of folks that while they may call themselves cybersecurity people or information security people, they may have taken the CISSP. That doesn't necessarily make you a qualified cybersecurity expert or professional. And so that's one of the issues too. And I just saw something recently where somebody was saying we got a lot of people out there who are going and getting a certification and then calling themselves a cyber expert. And,
right.
It takes more than that to create that kind of expertise. But we're, one of the things that we're doing too is we're really focusing on a lot of these younger folks in the industry that are coming into the industry, because they are so tech savvy and they learn so fast, that with the right training and the right environment, the right experience, and they're so motivated to learn. And they're excited about, when they come in, they're excited about this field, which is what's really cool. And I think part of that's because, as I tell everybody, I've been in this for 40 years. Every day is different. Right? It's never been a dull, it's never been one of those things where I come to work and say, I'm doing the same thing I did yesterday, or I see scenarios that are similar, but every problem that comes up, and there's new problems all the time, which I think for a young person, that's a really cool place to be, and where you just don't get bored.
Yeah, absolutely. And technology changes every day so fast, so your job's going to be changing all the time too.
All the time.
I had the pleasure of speaking with Angela Rivera. She's your Executive Vice President of Operations. I think we have an article still about her on Cybercrime Magazine. So how did you find her? How was she able to make the transition from what she was doing previously to healthcare cybersecurity? So
I met Angela almost 20 years ago when I first took that first job, and it was with a company called CTG Healthcare Solutions. Angela was one of the top salespeople at CTG at the time. And Angela from day one impressed me as somebody who, you run into these salespeople and they're just salespeople. And then you run into these ones that are client managers, client relationship managers. And Angela had relationships with her clients that were phenomenal, which is why she was so successful. She understood. She knew how to listen. She knew how to solve problems. She knew how to go harness whatever resources she needed to bring to give them a solution that was going to work for them. And she just grew over time. And I watched her. And even after I left, I paid attention. And Angela just was phenomenal. And she grew from being a salesperson to a sales leader, from a sales leader to a general manager of the healthcare division for that organization. So she just had this deep knowledge of healthcare and healthcare IT and whatnot. And when I was at that organization, she was one of the few salespeople who actually was successful at selling cybersecurity services for us. And again, because she took the time to listen and to learn and to understand what was important and to be able to work with my folks. And so when she, it was just by happenstance a year ago that she left that organization and was available. And I always tell people I have to pinch myself because I didn't think I would ever be able to get Angela to come work for us. And the reason I say that, not because I don't think we're worth working for, but it's because she could, in my opinion, she could, literally write her ticket wherever she wants to go. She's just that good. And so I was really happy to be able to join her to the team.
What can you say about getting more women like Angela involved in cybersecurity?
Well, the first thing is get in the field. I mean, this idea that that it's a guy's game is BS, right? Or that women aren't going to be as good at this as men are is again, not true. In fact, a lot of the young ladies that we have working at the company, I love watching them work because they're so meticulous, they're so detailed, they're just as curious as any guy ever was, but they are really good at what they're doing. And there's a certain part of our job that while it's technical and while it's problem solving, et cetera, there's also another part of our job that is very empathy based, meaning we're in a business of care, right? The organizations we support are there to care for folks. And that's what's most important. So when we approach our job, and I think that's one of the things that sets us apart from a lot of other cybersecurity companies that work with healthcare, we understand that our mission is to help them care for people, right? We don't exist just for IT or just for security. We exist to help them take care of people. And so understanding that and having that empathy in how we approach our job and having the focus that our job is about care, just like the hospitals is,
right, changes
how you approach it.
Yeah, I have heard that from other women in the industry saying that this is a career that's about taking care of people, doing the right thing. And
it absolutely
and all of
is.
the empathy is definitely something about the hospital industry. I wanted to ask you just real quick before we wrap up about the millions of unfilled cybersecurity jobs that will be the employment gap. And by 2021, Cybersecurity Ventures predicts it's going to be 3.5 million unfulfilled jobs. So with that backdrop, is it hard for the healthcare providers and hospitals to recruit and retain cybersecurity professionals? And given that, a lot of hospitals, we were talking earlier, they don't have the most robust IT environments. So does that make it even harder for them?
It does. There are a lot of different factors. The cost of these individuals. I mean, obviously, this is an environment where they're competing against everybody else who needs these people as well, and who may be willing to pay more for them in the market. It's also a factor of the environment they come into. These individuals, they're excited about what they're doing. They're excited about opportunity, and they come into an environment where all of a sudden they don't get support and they don't get resources, and the organization itself doesn't support cybersecurity, and they go, I'm out of here. I'm going to go find a job where people are serious about this. And so we hear all of those things, and it's very difficult for them to do it. But I think one of the issues that we have, and I've said this over and over again, is that we are never going to create a cyber army large enough to fulfill all the need. Mm-hmm. And even if we could, we're probably looking at 2 decades from now. And the question is, can we wait that long? And
definitely not. Yeah.
Yeah. So I think one of the things that we need to own up to, and we need to recognize, is that everybody in the IT field, whether they're a database administrator, whether they're a code slinger, whether they're a network person, you name it, needs to have cybersecurity skills. And so whatever they're doing, they need to be able to do it not only from an operational efficiency perspective, but from a security perspective as well. Then those few cybersecurity warriors that we have out there that are the real experts can assist them and can provide oversight and can provide support to them. But we're never going to have, I don't believe we're ever going to have enough cyber folks, period, to do everything that we need them to do and to secure our environment. It's just not going to happen. So I think the CIOs out there and the C-suite needs to recognize that this is part of who we are. This is part of what we do. And if you're in an information-based business, you have to have cyber skills, and that means everybody.
And where can they learn some more about that from CynergisTek? I know you do some educational stuff.
Well, we do educational stuff, but the other thing is there's a lot of university programs. Last week I was just with the University of Texas looking at their lab that they've created for healthcare professionals to learn about cybersecurity in the workplace. There are these cybersecurity centers that are being established across the country in different university environments. There are cybersecurity courses that are offered out there. Some of these are certificate courses, which I think are perfect for healthcare professionals. So they don't have to go back and get a master's or whatever, but they can go back and get a certificate because it's a shorter course. But it's focused on what does a healthcare professional need to know about cybersecurity in their environment. So I think it's out there, but they have to go get it.
So where should we get some more information about CynergisTek? We're calling you a small giant of cybersecurity. What should we be paying attention to next for 2018 and 2019?
Well, I think the real exciting thing that we're doing right now that's kind of a breakthrough this year is in the realm of medical device security. It's been a long pain point for me in terms of what the industry has had to deal with in that respect. And part of the problem in addressing it is that we've had the hardest time just being able to effectively find these devices, inventory them, identify where they're at in the environment, be able to assess what level they're at, not just from a maintenance perspective, but from a security perspective, because we didn't have the tools that could do that. And today we do. And so now we have services that we've been providing and starting to provide to our hospitals where we're able to go in and passively monitor their network, identify where these medical devices are, identify exactly where they are in their maintenance cycle, identify where they are from a security perspective and where they are from a network segmentation perspective, and provide that information not only to the clinical engineering folks, but also to the IT and security folks who can then better manage those devices and reduce the risk.
That's great. And you're in hospitals all around the country?
All around the country.
Awesome. Thank you so much for coming in today, Mac.
Thank you.
It's been a pleasure.
Thank you.
We'll learn more about you on our article and on your website coming up.
Look forward to it.
Thank you so much.